improving the world, doing great things. There's such an enormous potential for doing good things in this world without sacrifice or without other things. There's enough to do. Just start, don't worry about it too much, and start moving, because there's so much to do and it doesn't have to start big. It always starts with the first step.
Dear community members, thank you for joining our very, very first Moral Ambition talk with a guest I'm super happy to welcome, Niek Versteegde. Thank you for being here. My name is Julia van Boven. I'm one of the co-founders of the School for Moral Ambition and your community director. We're happy to welcome you here because we're experimenting with this new format called the Moral Ambition Talk. And the reason why we do this is that we have learned that many of you want to make a bigger impact in this planet and want to use their career to do good, but you don't really know what cause to work on or how to best work on those things. And at the same time, we also have so many people in our community who we consider role models of moral ambition. People who already dedicate their careers to solving big problems, problems that are sizable, severely overlooked, and also that can be solved. But I think the most important part is to learn from our speaker here today. And I'm just going to briefly introduce Niek and why we choose to invite Niek. Well, the first time I heard about you, Niek, was because one of our circle participants, Chantal, she used to work in business development and marketing for a Dutch scale-up in healthcare. But she was struggling, is this enough impact? Can I do more? Can I make impact on a bigger scale? And she decided to quit her job and to start working at Goal3, the organization that you found, because she felt that's where she can really make significant impact. That's the first time I start to read about Goal3, the organization that you built. What you do is very sizable. You give access to healthcare to people who don't have it at the moment. At this moment, this is still 4 billion people in the world who don't have access to essential healthcare services. And more than 15 million deaths could be prevented every year. Also, you show that giving access to healthcare services prevents these deaths and reducing mortality by almost 50% with the work that you do. That's really, really, really huge. It's severely overlooked. Consider that in Malawi, the average amount of money spent per person on healthcare is just 42 euros. While in the Netherlands, this is already 6,000 euros per person per year. So the contrast is huge, and how important it is to actually dedicate one's career and time to creating access to healthcare for the many people who still lack those. So for me, Chantal's shift to your organization makes perfect sense. And it also made me very curious to know, who is this guy, Niek? Why did you do it? How did you do it? And I can imagine I'm not the only one who's very curious. So therefore, very, very, very happy to welcome you as our first guest for the Moral Ambition Talks. And handing over the word to you now, Niek.
First of all, I'm very happy to be here, and I consider it an honor to be here, to be used as an example of moral ambition. To be fair, after reading the book, I also found it a bit intimidating because I don't compare myself to a lot of the historic figures that are used in the book. But nevertheless, I think that's maybe exactly what I can bring, because ultimately I believe it's just about doing what's right. Don't overthink it, don't make it overcomplicated. And that's what I will share a bit of a story about today. I will try to make it fun, entertaining, relatable, because I understand not everybody is an expert in healthcare or in global health or whatsoever. So as Julia said, I am a doctor turned entrepreneur. I'm an MD specialized in tropical medicine and international health. I also specialized in family medicine after that. And I started a company called Goal3 5 years ago. Goal3 as a reference to Sustainable Development Goal 3. And we're now 5 years old. We have raised over 5 million euros in investment money. We are doing quite a number of research projects, and we have developed the IMPALA system. And the IMPALA system is a patient monitoring solution whereby this is a universal need in each health facilities. But as a doctor, as a nurse, you need to monitor your patients to see how they are doing. You need to measure their vital signs. And we felt that this was a key ingredient that was missing from the context which we're talking about, which is mostly Africa. I'll dive into how it works exactly a bit more later. But where we are now is that we are, well, basically at the point between startup, scale up, really at the point of breaking through. I think in a lot of ways, we see extremely good results from the field, whereby we see a reduction in mortality ranging from 27 to 42%. That translates to cost per life saved of about $105 to $208. I think a lot of people will know about effective altruism, as it's also in the book, but according to GiveWell, Open Philanthropy, those organizations, the cost of saving one life now is about $4,000 for vitamin A or malaria nets. And we are now so approximately 20 to 40 times more effective than these interventions, also reducing workload, also saving costs. And this is not to brag or in any way or to say, but it exemplifies on where we are and where we believe we can go with Goal 3. And there's still a long way to go to achieve the 4 billion people that we want to achieve and save the 15 million people, of which 8 million is due to the low quality of care. Access to care is a bit more challenging for what we do. But that's where we are, and that's where our North Star is. And we expect that based on our current projections, over the next 5 years, we can save 180,000 lives, children, neonates, but also adults, by scaling up our intervention as it is, using the results we have to date. So that provides a bit of a context on why I do believe it's applicable. Where we are, it feels for me quite early to take this stage, yet at the same time, I do explicitly have this ambition, and so does my whole team, to reach those 4 billion people, to save a large chunk of this 15 million people dying. And we don't save them ourselves, of course, but we want to enable others to do that. But this is not where I started, of course. To be very clear, I wasn't born like this, and nobody actually is. I remember as a student, I was in med school, always been mostly very compassionate about the world and the well-being, not for a specific reason, not specifically raised for this, but it was in my nature to be concerned about that, to be concerned with other people. And this was frustrating me as a while I was a student. Actually, I felt I could do a lot more than what I did, but I was not able to channel that. And the way I described it sometimes is that for the people who know Schindler's List, this story is familiar. So Schindler's List is a film by Steven Spielberg in which you follow a tycoon, a manufacturing tycoon in Germany, who initially exploits the Jews and eventually uses his capital to save a lot of people from dying, from being brought to the destruction camps. And the latest scene is about Oskar Schindler, who is crying, surrounded by people who he saved, that he did not give away his ring, that he did not give away his car, because those represented people there and then at that moment. And somehow, and of course, I had a good sense for drama. It's a bit maybe exaggerated, but it felt to me like that because I had this capacity. I was doing a lot of things I had a lot of free time, and I wasn't really putting it to use. So when I found the path to become a tropical doctor, and I first went as a student doctor to Tanzania, I really know, yeah, this is really where I can make a difference at places where it's needed the most. So I became a student doctor. As a student doctor, I really felt, yes, I'm making a difference. Then one of my closest friends who I met there started a foundation, invited me to join. So I started a foundation together with him and a number of other friends to support at hospital. I specialized to become a doctor in tropical medicine and international health, and I returned to the very same hospital. Over all those years, I've been building, doing projects, and in parallel, while doing my training, doing other things, I was trying to make an impact in the very same hospital that I worked before. When I started working in this hospital, my wife was unfortunately unable to join me. And basically what I did was working day and night because I could only go for a year and a bit. and I really wanted to squeeze everything out of it. And one of the projects I did was the starting of a neonatal care unit. And this was quite special to me. So for me, it was really important to make a lasting impact and not just like a hobby project, something that made a difference that could be sustained. And one of the first children who survived because of the improved quality of care was a premature boy that was the cousin of one of my colleagues. So the sister of this colleague delivered. I did a C-section. I resuscitated the child and put him on this new neonatal care unit, and I took care of him very closely. And this was at a moment that was quite difficult for me. I was really going all in, and that the balance was not very healthy. My wife wasn't there to guard me, so I was going all in. And for me, this child became a beacon of hope. And his parents named him after me. Niek, his full name is Niek Mandela. We always call him Tanzania. That was an important beacon of hope, and he survived, and his mother survived, and that was really amazing and special at that time. What came even more special 2 years later, when I returned to the very same hospital with my wife and my 1-year-old son Gus, and I saw how these two boys played together. And everybody can imagine what it's like to make an impact. When you see these things, yes, it makes a difference, but somehow things change when you become a father. When you see your own child, when you see that. And for me, that was transformational. Even while already was impact driven, this is what really made me feel it. And this is what drove me to really pursue this even further while I was already on this path, and to keep persisting on that. But the other lesson I also took from Sengerema was that what I was doing was not scalable, because I took a lot of research. I collected the money, I asked people to help me, and there I started a neonatal care unit, but it didn't make sense. I was reinventing the wheel. It was not scalable due to resources, but also the way it was set up. And it was only sustainable to a limited extent. And that didn't feel right for me, because and I think this is where it touches upon the book of the moral ambitions. Like, there's 5 million children dying each year. It doesn't make sense. They're dying for bullshit reasons. So even after starting this neonatal care unit, still a lot of children died, and it improved care a lot, but still a lot of children died, and that didn't make sense to me. So that is what really put me on the path about, okay, this is something I would like to solve, to improve. I don't know how. I just knew this was important to me. And I returned. I did my specialization as a GP. I still do it as a GP. And actually, while doing these choices, I already thought about why I would do it. And I realized as a GP, I would have more flexibility to do other things next to my job than to just work as a GP. Whereas if I would have become a specialist, that would have been difficult, because a specialist has to work 32 hours minimum in a week, which typically turns out to be 50 hours. And it would leave limited capacity for doing other things. So now fast forward a few years, and I ran into my co-founder, Bart. This is now 6 years ago, and Bart was a student industrial design, and he was making a patient monitor for babies in low resource settings. And that was when 1 and 1 became 3, because that really helped me to assess where do I want to go. Of course, I didn't say immediately, okay, give me that, let's do it. I started slowly by talking to him, and as we went, we felt there was a good connection, and we both felt that if we're not going to bring it, nobody else will. And that's really the start of Goal 3, also linked to very personal milestones in my life. The healthy delivery of my daughter Jet, who is now turning 6 in April. So for me, that was a requirement, that my wife and my daughter were healthy before I could really say yes to let's do this, because otherwise I could not go in. And I think for me, it was not a very conscious decision or a very purposeful decision, like doing all the pros and cons. I just knew this could be something. Let's go and let's start moving. And I think that is what characterizes us. We know the direction. So in Goal 3, we have very strongly embedded the purpose, because for us, it's not about entrepreneurship or building a cool company. It's about solving a real problem. That's why we named Goal 3 after Sustainable Development Goal 3 to reflect our purpose, but also our ambition. So really, we want to make a global impact by 2030 on SDG 3. Then our vision is fair and accessible healthcare for everyone. Our mission is to enable and empower health workers where it's needed the most. But we believe social entrepreneurship to be the best means to an end, because it allows us to attract capital to develop something that's unique, that can really solve the problem. Because if you make something that is valuable, people will pay for it, and it pays for its scale, and it can be sustained. And that is really what made us move in this direction. From there, we have started moving, and we are all first-time founders, but we were very conscious on what we wanted to achieve. And I think this is the purpose we captured. And that has really allowed us to gather the people around us, to assemble a team or people who would share this vision, who would share this vision and really say, yes, I'm willing to go for this. So we are with a founding team of 5 founders. So there was one more who basically took a different path, but we're still together. And we're quite different persons, but what ties us together is the shared vision. And that's actually also what creates the synergy, because we have a shared vision, but because we have very complementary properties. That's what really keeps us going and helps us to learn and evolve as the company evolves and we're going through these different stages. So that is where we come from. And then regarding the solution, I think what is also embedded in our vision and who we are is it's always important to fall in love with the problem, not the solution. And that is to make clearer what that means, at least to me. You could say it's about the technology, right? And we have this monitoring device and it's amazing, and it's not that. Ultimately, we have to assess what is the problem. And the problem is people are overworked, children are dying for bullshit reasons. That is the problem that we're trying to solve. Important in that is that it's not my problem, it's somebody else's problem. So you have to be aware of how they perceive it. And ultimately, and I think that's the beauty of a business model, they need to be willing to pay for it, because otherwise it's not their problem. It's not a real pain, right? So that is how we have set out, and also looking in the context. And I think one of the things that drove me to entrepreneurship is also that I don't believe that an NGO model can really bring such a scalable solution, because we can always ask for more money, but the challenge is, how do you achieve more with the scarce resources that are there? And that's really our mindset. How can we help to achieve more with the scarce resources that are there to ultimately come to a solution that benefits patients, that benefits health workers? And that is what we have been working on. And then to dive a bit into the under the hood there and take you aboard in the world of a clinician working in the setting, it's a very stressful environment. There are very many patients. In the time that I worked in Singerema, it was not about if we could take more patients. It was about even basic stuff. Antibiotics were sometimes not there. Gloves were not there. So it's really a situation of poverty, I could say, whereby you really have to assess, like, okay, how am I going to solve it? And continuously you're in some kind of frustration. And what happens in such a situation when you have very many patients, you do not have the appropriate equipment, what happens is that you become very reactive in nature. You're constantly running from one emergency to another, running your ass off, and it never feels like it's enough, because you always feel like you're failing patients who need and deserve more attention. And this is where the ingenuity of our solution comes in. And I could not articulate this, of course, when I met Bart for the first time, but I think that's also why it's so important to fall in love with the problem and then just keep going, learn, evolve, make the next steps, and make sure that you really own it and bring it to the next step. What I realized, and I'm now 5.5 years into the journey, but only 1 year ago, I was able to articulate that people were caught in a vicious cycle, because they were always running from emergency to an emergency. This is where I could really see that by a deep understanding of the problem, that really now helps us to break that cycle and move further. So what we do is we provide a monitoring device specifically designed for this setting so that it's robust, that it can resist heat, moisture, insects, to make sure that's user-friendly, so that also people who had 1 year or 2 years of training to really operate the system easily, compare it to how the iPhone was introduced. People before that had smartphones, but it was too complex and people didn't feel comfortable using it. So how do you make something that can be used? And then how do you understand the whole chain of events? Because ultimately monitoring is just one step of the event. Health workers really need to be able to see which patients are high risk, which ones are low risk, which ones are improving, and which ones are deteriorating. Therefore, we collect this information, display it on a tablet, and then make sure that the information is easily accessible. This is the technology, but then we also invest on how do we make sure that people have the skills and knowledge they need. So we have really designed our business model so that you can really address this, that you can provide the training to people, that you can provide the support that they need to really make sure that the system is working and remains working. And for us, it's really about, we have not succeeded until that health worker is better equipped and the patients receive better care. That's when we're successful. And before that time, we're just selling bullshit. So for us, this is very important. And this is what I see as the problem. But even there, it doesn't stop. And so conventional wisdom in economics would say you would not go to public health, you would not go to pediatrics, you would not go to neonatal care, you would not go to Africa, because how are you going to make money in a very complex system where there's no money? This is, of course, a bit of an exaggeration, but this is the reality. It's complex. And even within those contexts, there are contexts which are even more complicated. Malawi is one of the poorest countries in the world. But we have said, like, we're not going to walk away from that because it's difficult. It's against our mission. So we started Goal 3 Foundation so that we really can make sure that we can provide part of that solution. So we can attract financing together with partners whatsoever to help hospitals who are working in this context, which really need it, but cannot start on their own. And this is really what I see as fall in love with the problem and not the solution. You really have to see, okay, the problem is not confined to a certain area. The problem is patients are dying for bullshit reasons, and I want to stop it. And together with these puzzles, we can, bit by bit, work on systemic change. Last summer, I was back with my family. I actually met my wife in Tanzania as well. She was an intern from Amsterdam. I was from Nijmegen. So what you get from far is always good, they say. So far, so good. We're happily married and have 2 children, but we were there together. And I met for the first time again since 7 years. Before that, Tanzanique. And I saw again how this 9-year-old Tanzanique was playing with my 8-year-old son Gus, and they were now really playing football together. And that was really powerful and really see it going. But at the same time, I saw in this very hospital where the ideas originated from where I worked, I saw that my colleagues were working with the system and that they were saying it was helping them. It was making their life easier. When we compared the before and after results, we saw a 27% drop in mortality, meaning that in one single hospital, in the hospital where I worked, 50 children survived because of the IMPALA system. And of course, methodological, you can maybe take some discounts here and there, but at the end of the day, we get consistent good results, and I'm confident that these results will uphold a larger scale because there's also room for improvement, and that's really impressive because that's 4.5 football teams, right? That's what impact is. And if you then look at what we have done as Goal 3 over the last year, we estimate that about 250 children survived because of IMPALA, and that's powerful. And if you now think ahead and see where we could go with the skill and whereby we could still transform this further by adding more value, by making more steps, we can achieve 180,000. And there's more benefits to it because it unloads the health workers. It has a dramatic impact on the economic potential of countries. It's breaking a vicious cycle at a whole other level. And that's really where we would like to go and whereby we really want to make steps to go there, but also continuously look for ways to accelerate that. And that's the level of urgency I guess I have specifically as a doctor. Ultimately, I really believe these are conditions which require seconds or minutes to respond. If we don't act now, those children are gone, they're dead. If I achieve 180,000 in 4 years, there will be a lot more children who have survived who would not have survived otherwise. And I think that's really what is driving me. Well, it may sound quite extreme in a lot of ways, living at that, and yes, it can be hard. It's a tough journey sometimes. I'm having fun. It's great time. I'm literally sitting in my backyard, improving the world, doing great things. There's such an enormous potential for doing good things in this world without sacrifice or without other things. And I think that's the beauty, and where I would like to conclude with there's enough to do. Just start, don't worry about it too much, and start moving, because there's so much to do, and it doesn't have to start big, because it always starts with the first step. To be honest, when you're an innovator in public healthcare in a place where there's no money, it sometimes feels like pushing a rope, or a lot of times it feels like pushing a rope. NGOs, governments are not known for the fast movingness. They're also not very known for risk appetite. So it really requires persistence and a strong belief in what you're doing to keep things moving. And sometimes when you're waiting for the regulatory approvals and you can't just move, when you're getting an appointment and the follow-up just drops dead, and it's like, it's not even my problem. So that can be really frustrating. And I've thought that, because it's not an easy route, and it's tough sometimes. Why do I always keep getting at it? For me, it's about Guus, Tanzania playing together. That's what it's about. If it was Guus, I would never give up. I would always continue. I would never give up, and I would sell every asset I have. And if you put that into perspective of where I am on the opportunity of impact we can make for other people, then we can't just give up. Of course, you have to maintain your sanity, and you have to take care of yourself, because it's not always a healthy environment. There's a lot of pressure to perform, but I'm up to that. I can handle that. And so I would never give up because of that, right? And I think this is what keeps me going. It's just like, in the end, it's about children. It's about my children. It's about anybody else's children. And it could be anybody. It could be a child of a friend I know. And this is really what, in general, I'd say you have to position yourself in the people who you're trying to help. And when you do that, then the answer is very simple, and you just keep going. And to share that story, I think is valuable to me as well. So I thank you for taking the time to listen to me. I also want to offer people seeing this now or in the future, feel free to reach out to me. If I'm too busy, I will tell you, but feel free to send me a message. I'm always there to help. In a way, I think this is what it's about. People coming together, seeing how can we change the world for the better, and there we have to bring support to each other. So thanks.